You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, how to reverse your TMJ problems, whether it's migraine headaches, sore neck, things like that. With us, we have Southern California's TMJ specialist. We have Dr. Frey. Dr. Frey, welcome to the program.
Thank you very much. Nice to be here.
Welcome back to the show. Now, I know I called you a specialist at the beginning of the show, but I guess TMJ disorders or treating them is not a recognized specialty in dentistry, but
That's
this
correct.
is your focus. I mean, this is what you do.
This is what we do. This is our passion. It's something we do every day. We help patients who are having severe headaches, neck pain, jaw pain, facial pain, all around their face. They point here, they point here, they point here, constant tension. Believe it or not, Randy, we can get rid of that.
Now, when I met you several years ago, I was kind of rough on you because I was totally skeptical. One of my buddies goes, Randy, it doesn't work. That same buddy and everybody else and the medical doctors believe this is mainstream now. I mean, it's working.
It's working.
A dentist with training can reverse these migraine headaches and things like that.
It's really unbelievable how the science has evolved over the years to kind of help dentists get what we call harmony between the muscles of the jaw joint and the head and neck and the teeth and everything. So when everything's in balance and you're aligned, believe it or not, headaches can go away, they can vanish, diminish, neck pain, and these are chronic.
Does it really happen? I mean, you see it in your practice?
Every,
people that had migraines for many years?
Every day. It's really remarkable. I just had a patient who told me she's been suffering from headaches. She said on a scale from 1 to 10, an 8 every day. And as soon as we treated her, they're gone. It's almost like I don't believe her, but they're gone. So, and they stay gone. It's really, really remarkable. And you have no idea how debilitating these symptoms can be on patients. Suffering from headaches day by day could be, these patients cannot leave their house. They have to be in a dark room. They close all the lights. They just can't go to work. They can't function. Their children, they can't play with their children. They can't be a proper mom. And believe it or not, TMJ affects mostly more women than men.
So the TMJ is like this joint right here?
Right, it stands for temporal mandibular joint, but they call it TMD also, which is temporal mandibular disorder, which means that it encompasses the whole head and neck.
How is it, help me understand, like a dummied down version here. How does it give someone a migraine or a headache?
The way it works is that if you put sensors on the muscles, even like the ones that are very close to your skin, just little sensors to read what kind of activity is this muscle, what kind of stress is this muscle under. And like an earthquake on a Richter scale showing the earthquake, we could see that this muscle is hyperactive on a constant.
Because your teeth aren't coming together properly, the muscles are having to work more?
Well, no? Sort of reverse. Okay. When you have a hyperactive muscle, we try to relax the muscle. And we use sophisticated medical instrumentation to help us relax the muscle. Once those muscles relax, we say, well, I wonder where the jaw is, because this jaw is in a free-floating bone, and it's in a sling of muscles, and it's not attached to the skull. So when all these muscles are fully relaxed, the jaw, like a boat in water, it rolls around. So we say, where is it? And we see where it is, and what we do is we take our dental Play-Doh, and we kind of capture that position. All right. And that's sort of the basis of how we start. The muscles dictate to us. We try to find a happy, relaxed muscles, all of them together. Let me give you an example.
All right.
Say I said to you, I want you to thread a needle. You would take your needle and you take your thread and you would thread it. And most likely you would go into the center of your body, right here. Mm-hmm. If I asked you to thread a needle out here, how many hours can you thread a needle in this position?
Interesting.
You'll get fatigued, you'll get tired, and maybe you'll start to have pain. But here, you can thread your needle all day long. You can work for 8 hours a day doing that because you're in a place where all the muscles are in that sweet spot.
Okay.
That sweet spot. That's what we're looking for. And there's a sweet spot, believe it or not.
Of how your teeth come together?
Of where you're most relaxed when your teeth aren't together.
Okay.
Just where you like to rest. But the teeth sort of keep your muscle where we're very close to where that position is. So we call it home. When your teeth come together, your bite is, we call it home. When you close your teeth together, you find your little home position. If it's close to your physiologic correct position, your place of the sweet spot, then you're going to be there all the time. You're going to keep in that same position if you're very close to it, and that's what we do.
So back to the migraines and this TMJ, how is it causing pain in the head or cluster headaches or whatever?
Right. So my example is this, is that just the needle, threading the needle. If you're threading a needle out here constantly, meaning you're out of alignment, you're not in your sweet zone where you need to be doing your work every day, you're putting stress on your muscular system around your head and neck. When you put stress on day after day after day, eventually your body weakens and starts to scream out in pain. So there's a difference between what we call signs and symptoms. So symptoms are when the body just can't take it anymore. I have a headache. I have a neck pain. I can't take it. My body's telling me that. But I could have looked in your mouth and saw wear patterns on your teeth, or the way your teeth were, or the way things look around your head and neck, and say, do you have headaches? Do you have neck pain? And they may say yes or no, because they haven't yet gotten to the point where we call it breakdown, when your body starts to break down. So there's a difference between signs and symptoms.
So with TMJ, okay, with my limited research on this topic, like clicking, these are some of the symptoms that you probably have a problem. If you're grinding your teeth,
that's right,
you have a problem. If your teeth are short and flat,
that's right,
you may have a problem. Wake up with sore jaw, that's a problem.
I would wake up every morning and click my jaw, click. It would like pop out of the socket. You know, I would get like a pop. And so many patients tell me it, and I knew that.
Is it a little normal though to have a little bit of that going on?
I mean, yeah, it probably is in our society today, but I'm telling you it's correctable because I corrected it on myself. So now when I open and close my own mouth, I had the procedure done on myself. Because I started not sleeping well. I started waking up in the middle of the night, and I was having a little bit of sleep apnea. And I knew my bite was really not in harmony with the muscles. And so I went ahead and fixed it on myself.
Have you had people that have had migraine headaches and now they're gone?
That's right. Yeah, so this science works.
Because migraines are a big problem, right? I mean, a lot of people have them.
That's right. I mean, it's
like millions of Americans have them.
Right. So people should look in their mouth and see, do I have wear? Are my teeth worn down? Does my bite look perfect to them?
So if your teeth are wearing down, it's because you're in the middle of the night grinding them.
That's right, which means that your muscles aren't happy and that you're not in a happy place. Is your jaw clicking? Is something weird? You know, if not, and you can start to relate this all together.
Okay, good. Now you brought a lot of photos, by the way, because you're also, I mean, people need to know. I mean, you're like known for your cosmetic dentistry in Beverly Hills and TMJ together.
That's right.
So you get a mix of both people that come in because they want to fix their migraines,
right,
and people that want a beautiful smile.
Right.
Does it always go together?
Well, what we're doing is we're listening to each person's body, and we're listening to where they need to be, where they actually function the best. And so by putting them in that position of where they're supposed to be, where God really intended them to be, they're going to have a gorgeous smile, but they're also going to be pain-free. They're going to be lacking any headaches or neck pain or facial pain, and they're going to live a happy life.
Now, on my show, we always have to make sure that we have these legal disclaimers. You know, virtually painless or pain-free, things like that. So it obviously doesn't work for everybody 100%. But for some people, it works.
That's right.
Like 100%. I mean, you have people that their headaches went completely away.
Right. We can't help everybody. We know that.
Okay.
But we try our best to help each person. And so what happens is we call it phase one. Phase one is trying to find that place where you can rest, where your muscles are in the most relaxed position. And we try to let the teeth guide you to where that place is and hold you there. So it's not where the teeth are actually biting, but it's just when they're resting, just releasing only a millimeter or so away from their bite.
You were telling me something in the green room. You said that everybody has an excuse. Like they have a TMJ problem, they have migraine headaches, but they say, oh no, it's because of this or it's because of that.
That's
Elaborate
right.
on that.
It's so funny because patients tell me all the time that I didn't help them with their headaches, but their headaches are gone.
Okay.
right?
Okay.
But we fix their bite, we fix their smile, we put them in this position that we know can diminish greatly to virtually eliminate all head and neck pain. And so we put patients in there, but they always say, I'm on a computer all day. I work 8 hours a day in front of a screen.
So that's why they have migraines.
Yeah, I do this, I do that. It's always something other than an alignment issue. Just aligning things so it's level to the horizon, proper where the muscles want to be in a happy spot.
So what you were telling me was, because some people will come to you, not for TMJ, but they come to you because you're a cosmetic dentist.
That's right.
So you do a smile makeover, and then you happen to find out, and I'm not trying to put words in your mouth,
all the time
but that they have migraines, right? They didn't come to you for migraines, but their migraines go away after you've done their smile makeover.
That's a great point.
And you're saying that they don't want to give you credit for that.
Right. No, I appreciate you bringing that up. But some people do give me credit. I had a patient who I treated probably 17 years ago, and she had a problem with one of her crowns or veneers. And she called me because she lives 40 miles away, and she said, I went to this other dentist, and I think I'll come back to you and have you fix it. And while she was telling me that, she says, but you know, you fixed all my headaches and my neck pain's gone, my head, and she was just kind of rambling on. And I fixed that 17 years ago. It's still fine. And she still believes that I helped her with that. She knows I helped her. And so she came back to me after 17 years.
So it can last a long time.
It can be indefinite. You never know.
Okay, so somebody's watching this, they have a migraine headache here, 4 or 5 times a month. Maybe they've had some dental work in the past, orthodontics, whatever, and they go to you. With what predictability can you say, I think we could help you on day one with your equipment?
I think 90+%, I can see whether or not I will be able to help you or not on your first visit. I can tell, and I usually walk up to my office manager and I say, she's definitely needs my help. She's definite. This is an easy case for us to do.
You get excited about it sometimes? You're on the console and you go, boy, this is gonna be good.
Yeah, we're gonna change someone's life. I mean, when patients tell you that they can't play with their children, when patients tell you that they're losing money because they can't work, I mean, and you're gonna stop all that? I mean, we just had a nurse come in. She's in some sort of workers' comp program at her hospital because she can't function as a nurse right now. And you wouldn't believe the video that we shot of her when she was walking out of the office. She said she hadn't felt that great ever, so in years. And so that was just so, it made my heart, swell up.
So what'd you do for her? I mean, you take this RN who has a lot of migraines, can't work.
That's right. And so what we did is it's called phase 1, and we just put them through the program. So we find where their most relaxed muscles are.
I mean, you hook them up to electrodes or something.
Yeah, so let me show you sort of what it looks like, because it's pretty incredible. And you couldn't do this outside a hospital in 1950. This is dentistry today in 2017 with Pentium computers and high-tech equipment. It's brought into our dental office, where before I'd have to go to a hospital to get this kind of data from my patients.
So you put this RN, you put this on her, and you're seeing on the screen activity, whether her muscles are overworking.
That's
Is that right?
That's right. Yeah, so you see a muscle that's overworking. So what we're trying to do is trying to find out where it's not overworking. And so we use medical instrumentation, and we use some exercises and different things to get the muscles to relax. We do a lot of stuff to zone in on that right bite position.
So with that woman.
Right, with this woman.
You said on the first day she could feel some pain relief.
Right, well, what we did was once the first day that we put in her, it's sort of like, we call it an orthotic. It's a fancy word, but it's a fake bite. It's a trial bite that we put over your teeth. It's fixed, it doesn't come out.
You sleep with it?
You sleep with it, you eat with it. It never comes out, it feels fantastic. And so once I did it on myself, you can't go back. If you've been suffering and then you're helped, you're not going back to your old position if this thing's working and helping. So that's what we call phase 2, when we get people who say, I don't want to go back to my old position.
All right.
So once we help them, they stay there.
So is it a custom appliance, or is it a combination of appliance and dental work?
It's phase 1, there's no dental work. It's a custom appliance. It looks like, you can't even see it. Yeah, I have to
Like a
show you.
retainer, like an Invisalign kind of a looking thing?
It looks like real teeth.
Oh.
And they're placed over your existing teeth.
right.
And they're flush with your teeth, so you can talk normal and you can eat normal. So many dentists make a removable appliance for TMJ. It comes in and out of your mouth. Well, you can't talk with it. You talk like Elmer Fudd, right?
Yeah.
And you can't eat with it. So how are you gonna rehabilitate? How are you gonna get better? So it's sort of like, say you had a bad leg and you had a splint on your leg. Well, doc, I can't run with this thing on. I gotta take the splint off to run. Well, is your leg gonna get better?
No.
So this is what it is. You wear it 24 hours a day. It looks like real teeth. And people get used to it. It becomes normal to them.
Now you brought photos. What are we going to look at here?
Yeah, so let me show you. This is Patrick, and you're not going to believe what his teeth look like. He had a debilitating disease. It's basically something wrong with his stomach, and the acid from his stomach has eaten away on his teeth, and he lost all function with his bite. And he was suffering from neck pain and from some headaches, but he also wanted his teeth restored. So he's a really good, what we would call phase 2 candidate.
So he came to you for cosmetic dentistry, not for TMJ?
So he came for me, obviously, for cosmetic dentistry. He wanted my help. But when I start asking, do you have headaches? Do you have neck pain? Are you suffering at all? And the answer is yes. Well, I'm going to win on 2 fronts on him. He's going to get a gorgeous smile, and he's going to be in a better physiologic position. Muscularly, he's going to feel better.
Oh my goodness.
Look at that after result.
Is that the same guy?
Yeah, this is the same guy. Now, it's funny, but when you look at a patient like this, Randy, and you say, is this person suffering from TMJ? When you see such a perfect aligned face and some perfect, it's highly doubtable that this person's suffering from headaches.
So
the
he
first
told
patient,
you.
yeah, the first patient, he's suffering.
So he says he feels better.
He says he feels better. Oh, he's the happiest guy. I want to show you Diane. And Diane has what we call a deep overbite. This is one of the signs of TMJ, is people with deep overbites, we know they're not in function. We know that their muscles are not in a happy place.
Okay.
And she came in also for a smile makeover. And she's been suffering from headaches and neck pain constantly. And she had no idea that they were going to be gone by the end of her.
So you hooked her up to those electrodes.
Absolutely.
You realized there was a lot of problems.
That's right.
So do you tell her, not only are we going to give you some veneers, make you look good, but
Right.
I got a feeling your headaches are going to go away?
That's right. So what we do is we give them that trial bite, that little, we call it phase 1, and she wears that for 2 to 3 weeks prior to doing her smile makeover. We want to test it first. We want to see, how's this changing your life? Is this something that you like? So we just change the bite position. And you got to figure, bite positions are changed all the time. Think about orthodontics. How many people are in braces? What are they doing? They're changing their bite position. Well, if you're going to change your bite position, do you really know where you're going? Are they moving your teeth into a place where the muscles are most relaxed, that's best for you and your face?
Based on your own physiology.
That's right, based on your physiology. Not everyone's the same. Someone from Mongolia isn't the same as somebody from Thailand.
All right.
They're going to have different bone structures and different muscular structures. So we're trying to get everybody tailored in to what's best for them. So we have her in this trial bite. She wanted to get her smile makeover right away, and we told her, no, you got to wait. Just wait 3 weeks, a month. Let's just test this out and make sure it's safe. She comes back and she says, I can't believe it, but I've never felt this good. My neck tension is gone. My head feels lighter and better. And so that's what we needed to hear before we went ahead and made her smile makeover.
Because that tells you how you're going to put her veneers together.
That's right. Instead of putting her veneers together in her normal, habitual bite position, which was a deep overbite, which is going to cause a lot of problems for her in the future because the forces aren't right and nothing's balanced. We say, well, we're going to get it balanced and get it all right for you. And this is going to last you a longer time. But look at her face. So in one afternoon, her whole life has changed. And Randy, look at this. Look at her face. What we've done is by changing her bite position, by balancing things out, we've changed the way her muscles and her face sits. And just look at that picture, Randy. You could see her before. She's looked a little older. She didn't look as young. She didn't look as vibrant in the face. She didn't look as healthy. And so now she's in a more healthy position, and which makes it for a better smile. And that's why I got the result that I got.
Now, I'm not trying to side with you or endorse you, but Are you of the opinion that if you're going to get veneers done, cosmetic dentistry, you better find somebody that they have this subspecialty training to handle TMJ problems? Is that your belief? Like at Las Vegas Institute, this neuromuscular or physiologic dentistry?
My belief is that if you want to get your teeth done and you want to, and you say, why am I getting my teeth done? What happened to my teeth? Have they worn down? Are they tipped in? Are they crooked? Because that is something that tells you that you're not in a great bite location. The body has worn your teeth down over time. So if a dentist goes ahead and puts you back in that same position with beautiful veneers, you're still going to have that same muscular...
Like chip off the veneers or whatever.
That's right, and you're going to still be living with that same tension that you been living with before. So we want to correct that first and then place the veneers.
And the veneers will last longer because of it?
For sure. It would be like, say I had you walk on a piece of glass. If the glass was not level, you're going to crack it. But if it's level, you can walk on it and it won't crack.
Okay.
So that's why we do those kind of things. So yeah, that's what we call phase 2. The phase 1 is, let's make sure the bite is healthy. Let's make sure the bite's perfect before we do the veneers, which is phase.
That's only a couple of weeks.
And that's just one, and veneers are one way to do it. You can do ortho in phase 2. You can get braces. You could just get a removable orthotic like what most dentists give. We can convert that to that. Or we could go into nothing. Sometimes patients just can be weaned off it.
Now you treat, a high-profile group of people, medical doctors. I know one of the most famous plastic surgeons in the country.
That's right.
Who's been on the show.
That's right.
Sees you.
I used to help James Gandolfini.
From Sopranos.
From Sopranos. God rest his soul. But he used to suffer from TMJ, and I was helping him with that using these methods. And he wouldn't keep coming back to me if it wasn't helping.
Okay, good.
Yeah, and believe it or not, I've treated also some pretty A-listers for TMJ. I've even gone to their homes and helped them with, I can bring all my equipment, it's portable, and I can go to their houses and I can help them. I can find the bite location, get the...
Have you had people that have had, you're talking about this clientele, that had migraine headaches and now they're gone?
That's right. Yeah, so this science works.
Because migraines are a big problem, right? I mean, a lot of people have them.
That's right. I mean, it's
like millions of Americans have them.
Right. So people should look in their mouth and see: do I have wear? Are my teeth worn down? Does my bite look perfect to them?
So if your teeth are wearing down, it's because you're in the middle of the night grinding them.
That's right. Which means that your muscles aren't happy, and that you're not in a happy place. Is your jaw clicking? Is something weird? If not, and you can start to relate this all together.
And then, okay, so you have time for more photos.
Yeah, here's John. And John said he did a testimonial for me on my website, and he said, I used to have TMJ. I didn't tell him to say any of this. I used to have a click in my jaw. I used to have this problem and this problem. And they're all gone now. But he came in for a beautiful smile, and he's just blown away that I fixed his whole TMJ
So one
problem.
of the side effects of a smile makeover with you is maybe their headaches will go away.
That's right.
And their neck pain and everything else.
Well, I'm not going to do a smile makeover on someone who's got worn teeth and they're really worn off teeth because they're just going to break. And a lot of dentists will say, we can't do veneers here because your bite won't tolerate it. So we fix the bite first, which is that happy place. And then we go ahead and place the veneers in that position.
Okay, good.
Yeah, this is Linda.
All right.
And she didn't show any teeth in her smile.
You can't really see her teeth.
Yeah, so she went to a TMJ doctor in Beverly Hills, and see that space that you're seeing in there? That space is where she's been living with her removable TMJ guard, which helped her. But now what does she do? She could barely put her teeth back together again because she's been living with this TMJ guard for so many years. So we were able to, in phase 2, go ahead and place veneers on her teeth and close that gap. And look at her face. I mean, really just changed her look entirely by giving her teeth, but also helping her jaw and her TMJ symptoms.
So her symptoms were what that went away?
Her symptoms were that she had neck pain and she had headaches. So they seem to go together for a lot of patients.
And so she tells you what, my headaches are almost gone all the time, or?
Yeah, but she was treated successfully from a TMJ doctor.
Okay.
The problem was that she had all this she had her teeth like in this position.
Like in a splint. She's living in a splint.
Exactly.
So she couldn't smile.
She couldn't smile.
So you turned her teeth into a splint, like a permanent splint.
That's right. And that's what we call phase 2, and that's what we did. We built her teeth into the splint, which is a place of harmony between the jaw joint, the teeth, and the muscles. And that's what we did.
We only have time we have like 2 minutes left.
Okay.
So I don't want to rush you, but go ahead and go through these.
Okay, so you're looking at Tracy over there on this picture, and see how she's pointing to her jaw. I always ask when I take pictures, I always say, point to your pain. Point to where you're suffering. I always take pictures of them, have them point to the pain. And this is phase 2 where I built her orthotic. I built her bite into the veneers.
Okay.
About phase 2, which is one way to do it.
Beautiful smile.
The gorgeous smile. Here's 2 more pictures of her. You can see how gorgeous her smile is. But you can just see her face is all lit up, and that you can tell that she's on. Here's Akiko, and she's in a high-power film industry, and she's pointing to her neck, that she's got pain in her neck. And so here's an after shot. She's pain-free. This is Myra. Myra, she had major headaches, and she will not give me credit that I got rid of her headaches. She came in.
It was a coincidence. So you did her what? Smile makeover?
Yeah, and now she was referred by another dentist. And that dentist laughs because when he talks to me, he goes, and Myra insists that her headaches are gone for a different reason.
Okay, let's take a look at this.
And that's her.
So this is the smile.
That's after, yeah, which is gorgeous. But,
so you just made her a comfortable bite. You call it a bite.
That's right.
And then coincidentally, her headaches diminished.
That's correct.
Right.
That's correct. Because what we did was the bite where we found is a place where her muscles are in the most relaxed position.
So you've tried to take credit with her.
I tried to, but I ended up winning.
You can't win on that one. Okay, we're out of time. So you've written the book, The Physiologic Dentist.
That's right.
This is all you do. You work with TMJ problems. So if you have clicking, popping, short teeth, migraine headaches,
neck pain, yeah, deep overbite, worn teeth, anything that may attribute to a clicking in your jaw or whatever you think, then I can help you.
That's your thing.
That's my thing, yeah. I love it.
Okay, good. You love it. You told me at the beginning of this, we're putting on the mic and you go, I could talk about this all day.
Yeah, that's right.
Oh, you love this. Good for you.
Talk to my wife about that.
That's what all you talk about.
Yeah,
right?
she needs to talk about something else, right?
Talk about something else other than TMJ. Thank you so much for coming.
Thanks for having me,
Always
Randy.
a pleasure to have you back.
Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.